everyone, Heather here. So what do you do if your patient kind of doesn't want you around and they just want to be left alone? Well, the first thought that comes to mind is sweet, one less patient to take care of. I scored. Well, it's kind of like that because since your patient wants to be left alone, they're obviously not going to be using their call light very much, are they? Sometimes you might go into a patient room and you're doing your patient assessments and trying to ask them questions, and they're just kind of ignoring you and pretending you're not there, and they don't really want to talk to you. And sometimes the patients might be a little cranky or sleep deprived because they were admitted in the middle of the night and they've been in the ER for 7 hours, and then they come to the floor and the nurse is asking all these questions and the doctor comes in and they're asking all these questions. So after all the millions of questions have been asked, the patient's thinking, come on, please be quiet. I just want to eat and go to sleep. So as soon as they start dozing off, we go in the room and we wake them up and we say, hey, there will be no sleeping allowed in the hospital. It is time for your MRI. Let's go. Come on. You have 14 tests ordered and I have 2,000 meds to give you. So after their 14 tests are done, lab will come in and draw some blood, and we'll go in and take some vitals and give them some more meds. And by this time, the patient really never wants to see us again. They don't even want us to come in and take their vitals. And I'm like, okay, that's cool, I'll try and let you sleep as much as possible, but there's just a few things I gotta do first. But seriously, I'm totally in favor of letting patients sleep. In the mornings, I won't even wake the patient up to do anything until I see him up ordering breakfast. I mean, who wants to be woken up for a darn nursing assessment anyways? And then during that time, I'll sneak in my nurse's assessment and pop some meds in their mouth and all that good stuff. But if they're the type of patient that really kind of wants to be left alone, then after that, after the assessment and everything, I'll just kind of pop my head in the door every so often to let them know that I'm available if they need anything and make sure everything's in order and they're not doing anything they shouldn't be doing. But when I first started nursing, I probably took it a little personal. I was like, what did I do? Why don't they want to be around me? And now I'm like, cool, you sleep, I got some other things to take care of, and you just ring if you need anything. And that's the way it is with some patients. It can actually be a good thing if you really think about it. Well, thanks everyone for watching. Talk to you later, okay? Bye!